Good morning. Nice to see everyone. Good morning. Yay. We're very excited to be here. And we're very excited that all of you agreed to spend the day here talking with us and learning about Parkinson's disease and learning about some of the newest research that we've been working on to try to find better treatments and better ways of diagnosing this disease. So thank you all very much for coming. We're very excited for today's presentation. So what I'm going to do is I'm going to very briefly run through the Hopkins Movement Disorder Center and also take care of a few housekeeping things along the way. So there's a few different things for folks to know about. So first, who we are. The Johns Hopkins Movement Disorder Center, we provide comprehensive, compassionate, and timely treatment to our patients. And we focus on both treating our patients, but also on research, as you're going to hear a lot about today. And then also we focus on teaching about movement disorders. So we try to train the next generation of physicians and nurses and physical therapists and occupational therapists as well, all about Parkinson's disease. And within the Movement Disorder Center, we have a number of different areas of specialty, including ataxia, dystonia, essential tremor, and of course Parkinson's disease, the reason we are all here today. The Johns Hopkins Parkinson's Movement Disorder Center, we are a Parkinson's Foundation Center of Excellence status. And this is a designation given to movement disorder centers where each center has a rigorous clinical research and professional education as well as patient care criteria. And really a lot of the things that we do for patients, we are able to do because of the Parkinson's Foundation support. So this entire event here today is through the Parkinson's Foundation and also through the Udall Center, which I'll be talking about in just a moment as well. So centers of excellence provide expert care to more than 145,000 people with Parkinson's. Those are obviously not all at Hopkins. And one of our goals is to advance research and provide patient education programs such as today. The Udall Centers are an NINDS designation, and this was a program in honor of Congressman Morris K. Udall, who was diagnosed with Parkinson's disease in 1979. And so Congress, in its infinite wisdom, began the Udall Centers in 1997, and Hopkins has been a Udall Center more or less since 1999. The goal of each center, and every year there are about 8 to 10 centers nationwide, and every 5 years we're up for renewal. And the goal of each center is to determine the fundamental causes of Parkinson's disease and to improve the diagnosis and treatment of individuals with PD. The Hopkins Udall Center focuses on improving our understanding of how a few very key and important proteins lead to Parkinson's disease. So you're going to be hearing about some of these proteins and some of this research throughout the day today, as well as about some of the things that the Parkinson's Foundation is doing and some of the things that we're all doing for our patient care. Specifically in terms of the research, though, we did our very best to set up our slides and give our presentations in such a way that they will be understandable to folks who have not gone to medical school. That's been kind of our goal. If at any time we are saying things that don't make sense because you haven't gone to medical school, please let us know. So if you have a question, I can almost guarantee at least 5 or 10 other people in the room have the same question. So our goal is to explain this, but we don't always know all the things that you guys know. So please ask lots of questions. I think it's really important, because we really want you to be able to understand what we're doing and the importance of what we're doing, and really hopefully leave the day with a sense of hope for the future and for all the things that we're learning about. So within the center and within our treatment, we also collaborate with speech language, occupational therapy, physical therapy, urology, GI, ophthalmology, because as you guys know, Parkinson's disease affects all sorts of different body systems. So we oftentimes collaborate with these folks, both in terms of patient care and in terms of research. And then within the Hopkins Movement Disorder Center, we have a number of Parkinsonism-specific subspecialty clinics. So Parkinsonism is a designation that we give to folks who have a tremor, a slowness of their movement, some rigidity or stiffness. And so we have most folks with Parkinsonism have Parkinson's disease. So we have a number of Parkinsonism subspecialty clinics, including our neuromodulation and advanced therapies, sort of also known as the DBS clinic. We have the atypical Parkinson's clinic, and then also the Botox clinic. So one other final housekeeping matter. We have where there's some index cards on all of your tables. If you have questions, feel free to write them down on the index cards with your contact information. If we're not able to get to your question today, we'll review the index cards afterward and do our best to reach out to you in order to follow up on whatever questions you may have. Hopefully we'll have lots of time for questions today, but we'll do our best to stick on time as well, as we want to make sure everyone can get out of here before rush hour. So without further ado, I'm going to introduce Dr. Justin Martello. Dr. Martello is the only movement disorder trained physician in all of Delaware, and he is currently practicing out of Christiana Care. So thank you very much, Dr. Martello.